Alright, in this video we're going to go over the muscles of the lower extremity, their origins, insertions, and actions. We're going to start with the more proximal muscles. So remember, proximal means closer to the trunk, or the point of attachment. And so proximal muscles are going to be more over here, the more distal muscles are going to be further away. So we're going to start with the more proximal, move to the more distal. Something to guide us throughout our understanding of muscle identification, origin, insertion, and action is that when a muscle crosses over a joint, we're going to have an action at that joint. We will get into that, but that is something that you're going to see pop up throughout these muscles, and that is going to help you understand what that muscle's action is, given its origins and insertions. So remember that origin is the point of muscle attachment that does not move. Insertion is the point of muscle attachment that does move. And what happens is, whenever a muscle contracts, it shortens in length, bringing the insertion point closer to the origin point. And when you cross over a joint, that insertion point may be on another side of that joint. I'll give you an example. So let's take the quadricep muscle group here, which we will dive into more detail. But the quadricep muscle group is going to originate up here. So we're going to see various origin points that we will talk about from the different quadricep muscles that are generally up here. The insertion of all of these quadricep muscles is the same. It's the tibial tuberosity. So we don't see it on this model, it's actually cut off. So it's going to be right around here on the tibia over the knee joint. So you can look at the tibial tuberosity, bridge-like bump right here. We were originating right around here, the point that does not move. Our insertion point was that tibial tuberosity. This is the point that does move. We're crossing over the front of the knee joint. The muscle is contracting or shortening in length, bringing the tibial tuberosity closer to the origin point. As a result, we have this muscle action here, which we would call extension of leg as knee, otherwise known as knee extension. Okay, so that's just an example of how we can use origin, insertion to understand action, and that concept of if we're crossing over a joint, if the muscle is originating at one side of the joint, so remember the knee joint is here, this is one side of the joint, we're on the femur bone, the other side of the joint would be being on the tibia bone. So if we're crossing over it, if we have an origin on one point and an insertion on another point, we're going to move that joint. So we're going to have something happening at the knee, and in this case, knee extension. Okay, so let's dive into these muscles a bit further, their origins, insertions, and actions. So we start with more proximal muscles. So we'll first point out that this is your iliacus muscle, and this is your psoas major muscle. So remember, the group of iliacus and psoas major gets the name iliopsoas muscle group. But let's start with the iliacus. So if we look at the iliacus muscle, our origin point is the iliac fossa. So let's locate that on this skeletal muscle model right here. So remember, this was your ilium bone, sort of the one that I'm holding with my hand right here, and a fossa is any pit or depression. So here we see a depression. So iliac fossa. So iliac fossa is our origin of the iliacus muscle. Remember, origin is the point of muscle attachment that does not move when the muscle contracts or shortens in length. So this is remaining fixed. The insertion is going to be the lesser trochanter of the femur. So let's identify that. So lesser trochanter of the femur is right here. So the iliacus muscle is originating on the iliac fossa. It's inserting on the lesser trochanter of the femur, which means that we're starting here, we're ending here. The muscle is shortening in length. It's bringing the insertion point, the lesser trochanter of the femur, closer to the origin point, the iliac fossa. As a result, we have this action here. So what we call this action, well, remember that anything that happens in the front half of the body is going to be called flexion. Anything that goes in the back half is going to be called extension. We have one exception of this rule. Remember that if we bring the leg into the front half, it's actually extension. So by leg, we mean the portion between the knee and the ankle. So this segment right here, if we bring that into the front half, we actually have extension. So that's the one exception to our rule. But in general, you bring a segment of a limb, in this case, the thigh, you bring it into the front half, you have flexion. And that's what's happening here. You have flexion of thigh at that hip joint, or simply hip flexions. So that was your iliacus muscle. Your psoas major muscle is very similar. So psoas major is this one right here. So this whole muscle right here. And we can see that the origin point is T12 in lumbar vertebra. T12, remember, we have 12 thoracic vertebrae, so that's going to be your last thoracic vertebra going from top to bottom. So remember that you had 7 cervical, 12 thoracic, and 5 lumbar. Remember that breakfast, lunch, early dinner analogy. T12, it's going to be on the lower end of the thoracic vertebra and lumbar vertebra. So T12 and the rest of the lumbar is going to be our origin point for this psoas major muscle. So it's going to stay there. The muscle is, when it contracts, it's not going to move T12 in the lumbar vertebra, rather it's going to stay there. Where are we going though from T12 and the lumbar vertebra? Where is this psoas major inserted? So let's see. Again, lesser trochanter femur. So very similar to the iliacus muscle, and that we are starting from over here and we're ending again at the lesser trochanter of the femur. So if you visualize this muscle, starts here, crosses over the hip joint, ends here. It pulls the insertion closer to the origin. So the insertion, the lesser trochanter of the femur, is going to get pulled towards the origin, that 12th thoracic vertebra, and 5 lumbar. As a result, again, hip flexion, or flexion of thigh at hip. So that's why these are termed the hip flexors, the iliacus and the psoas major. We can go to the opposite side of the body. And in this case, we're going to have a hip extensor muscle. So this would be our gluteus maximus muscle. So gluteus maximus just tells you, look to the gluteal region. So, all right, gluteal region. I'm the largest muscle in the gluteal region. So I see a big one here, but I see a bigger one here. So it's got to be this one. So gluteus maximus, largest muscle in the gluteal region. Where's the origin and where's the insertion? Well, the origin point here is the ilium, sacrum, and coccyx. And if we think about this, remember that we said this was your ilium bone, this is your sacrum, and this is your coccyx. If we look at the gluteal muscle in this muscle model, we can see that this checks out. It's definitely attached here to the ilium, the sacrum, and the coccyx. So pretty intuitive for us to visualize. And what's happening here is, we said this was our origin point. So that point is not moving. That is the fixed point of muscle attachment of the gluteus maximus, whereas the insertion point is going to be the gluteal tuberosity of the femur. So let's take a look at that. Gluteal tuberosity of the femur was not a term that we went over for the first practical. So it's a new term, actually. I believe it's the only new term. But remember, tuberosity was any ridge-like bump. If you look at the back of the femur, we see this ridge-like bump right here. This is our gluteal tuberosity of femur. And so if we're starting here, these 3 points, the ilium, the sacrum, the coccyx, if we're starting here, and that point's not moving, and the muscle is ending here, we're crossing over the hip joint. We're just in the back half of the body. And again, the insertion is going to move closer to the origin points as a result of the muscle shortening in length. I'll put this down so we can see. So this is going to move closer to these points, resulting in extension of thigh at hip, or simply hip extension. We have a couple more actions going on here, being lateral rotation and abduction of thigh at hip. These are more so secondary actions, and you'll find that the secondary actions, which I've underlined here in blue and here here, those are more difficult to visualize because they're not exactly the main actions, but they are required to study and know for the practical. So you just want to point those out. So gluteus maximus, in addition to performing extension of thigh at hip, also partakes in lateral rotation of thigh at hip and abduction of thigh at hip. So remember, what is lateral rotation? What is abduction? Well, lateral rotation was the lateral rotation of thigh. You visualize the thigh segment. Lateral means away from the midline. We know what rotation means, so that's going to look just like this. Abduction means you're going away from the midline. So you're going to bring the whole thigh segment away from the midline in this manner, just like that. Okay, let's move on to the sartorius muscle. Talk about that in a little bit more detail. So remember that the sartorius muscle is the longest muscle we have in our body. It crosses over the front of the thigh. So let's take a look at that. So sartorius muscle, longest muscle in the body, crosses over the front of the thigh. What are its origin and insertion points? Well, its origin point is the ilium. So remember, remember that this was our ilium bone right here, this one that I'm sort of covering with my hand. And so if we look at the sartorius muscle, it's definitely attached to the ilium bone. So we can sort of visualize that from this model. That's the point that remains fixed. So when the muscle contracts or shortens in length, what is it pulling on? Let's see. So the insertion point is going to be the tibia. Something to know about this one. So this one's tough. So you only need to know the tibia. You don't need to know the exact spot of the tibia for the practical. But understanding the exact spot of the tibia that the sartorius muscle inserts on will help you understand its action, being flexion of leg at knee. So it's actually going to insert on a medial portion of the tibia that's in the back side. So let's take a look at that. So we said sartorius muscle started or originated at the ilium, and that's the fixed point of attachment. The muscle is crossing over, and the insertion point is actually going to be on a medial component of the tibia. Remember, medial means closer to the midline. It's actually going to be on the back half of the tibia. So given that it's on the back half of the tibia, when this muscle that starts here and ends here, when this contracts, it's actually going to pull this portion of the tibia closer to its origin point, which as a result brings the leg up. And so we actually have leg flexion, reflection of leg at knee. And without understanding that it inserts on the medial posterior, so the back side of the tibia essentially, it's tough to know why does the sartorius do flexion of leg at knee. But if we understand that, we can help visualize it a bit better. So, but as we mentioned, when a muscle crosses over a joint, we have an action occur at that joint. Not only does the sartorius muscle cross over the knee joint, so remember we said it crossed from here all the way to this back medial side of the tibia. So we're crossing over the knee joint. But we can't forget, we started here. That means we're crossing over the hip joint as well. So if the muscle crosses over two joints, it's going to have two actions at the joints it crosses over. So in this case, what is happening at the hip joint? Well, we're crossing over it. We're crossing over it on the front side. Remember what happened when we had muscles that crossed over the hip in the front side. The iliacus and psoas major muscle that crossed over this hip, it crossed over this hip joint in the front side. We had hip flexion, a flexion of thigh at hip. In this example of the sartorius muscle, also crosses over the front of the hip joint. So we also have flexion of thigh at hip, or hip flexion. So noted here. And then again, we have some secondary actions that are a bit more difficult to make sense of, given they're not the primary actions. and you'll see it gets a bit less intuitive to interpret secondary muscle actions. But just note that you also have abduction and lateral rotation of the thigh at the hip, similar to the gluteus maximus. So we have those. Let's see. Okay, so let's go on to the knee extensors, otherwise known as the quadriceps. So remember, quad means 4, so we have 4 muscles in this quadricep muscle group. I'll take off the sartorius to make it a bit easier for us to visualize here. So quadricep muscle group, also called the knee extensors. So let's take a look at the first one here, the rectus femoris muscle. So when you think about the quadriceps, at least it helps me to think about it in this way. You have 3 vasti muscles, or vastus muscles, and you have one odd one out. That odd one out is the rectus femoris muscle, this muscle right here. Why is it the odd one out? Well, a couple reasons. One, it's not named vastus, like the other 3 are. 2, it's the only quadricep muscle to cross over 2 joints. So all the quadricep muscles, they cross over this knee joint. They end up inserting on the tibial tuberosity, which again, is what we're doing. So we're crossing over to that knee joint. We're going to have an action that occurs at that knee joint as a result. But the rectus femoris is a little different. It crosses over 2 joints. So rectus femoris origin point is the ilium. Again, ilium bone is right here. So the rectus femoris is originating there, and we can sort of see it in this muscle model. It's going right up to the ilium. You can't see it perfectly, but if we were to remove all these muscles, you'd see that it would end up at the ilium bone. Rectus femoris starting ilium. That means it crosses over the front of the hip joint. Remember what happened when we had several muscles now that cross over the front of the hip joint? We have hip flexion, or flexion of thigh at hip. So the rectus femoris is unique in that it also crosses the hip joint. Because it crosses in the front, we also have hip flexion as an action of the rectus femoris. But the rest of the quadricep muscles, the vastus medialis because it's medial, vastus intermedius because it's in between, and vastus lateralis because it's lateral away from the midline. These all do not cross over the hip joint, they only cross over the knee joint, and so they only have an action that occurs at the knee joint. So let's go over those. So, and we should probably mention, just to be thorough, that the rectus femoris, of course, crosses over the knee joint, right? So we're going to mention that all the quadricep muscles insert on the tibial tuberosity, which means that they pull the tibial tuberosity closer to their origin points. So remember, the origin point for the rectus femoris is ilium, the insertion is the tibial tuberosity. So it's going to pull the tibial tuberosity closer to ilium, resulting in extension of leg at knee. But okay, so let's go over the origin points now of the different vastus muscles. So we'll start with the vastus lateralis. So vastus lateralis is on the lateral side of the thigh. And so the origin point here is the greater trochanter of the femur. So let's check that out. So remember, greater trochanter of the femur is right here. But let's turn it over to the front. So vastus lateralis, it's on the lateral side. It makes sense that the origin point would be also on the lateral side because the muscle itself is on the lateral side. So greater trochanter of femur is that lateral origin point that we have for the vastus lateralis. The vastus, let's go in order here actually. Vastus intermedius, so now we're in the middle. Where is this origin point? Well, the femur simply. So it's more specific, but all you need to know for the practical is that it's on the femur. So vastus intermedius, you can visualize it. It's going towards head of femur, but for the practical, you just need to know that the origin point is the femur. So let's go now to our vastus medialis, our medial component. So vastus medialis, origin, intertrochanteric line of femur. It's a huge term, right? But let's break it down. So remember, inter always means between. Trochanteric, well, we have a greater and lesser trochanteric. Excuse me. We have a greater and lesser trochanter. Line. Okay, this probably looks like a line. Let's check this out. So, greater trochanter, a femur, lesser trochanter, a femur. Inter tells you it's in between. I have something in between. It looks like a line. It's right here. So this is the intertrochanteric line of the femur. Okay, so let's turn this back around. So that one was our vastus medialis muscle. So we are originating back here, and we are inserting, as the others do, on the tibial tuberosity. So essentially, the specifics are to study for the practical, but for understanding how this work, we've gone over it a bit so far, but just to recap, all the muscles originate right around here, which means that's the point where they remain fixed. So the proximal component of the femur bone essentially is where all of them originate, with the exception of the rectus femoris, which originates on the ilium, which crosses the hip joint, resulting in an action at the hip, being hip flexion. But all the vastus muscles essentially originate at this proximal component of the femur. They all insert at the tibial tuberosity. They cross over, one joint being the knee joint, they cross over it on the front side, pulling the tibial tuberosity closer to these origin points, resulting in extension of leg at knee, or knee extension. So that's our quadricep muscle group. Let's go on to the hamstring muscle group, as it's the opposite muscle group. And then we'll talk a little bit about gracilis and plantar flexors and the dorsiflexors. So, the knee flexors, or the hamstring muscles. So, we'll start off here with our biceps femoris muscle. So remember, the biceps femoris is the lateral posterior thigh component. If that doesn't help, just remember when you're looking at the hamstrings, which are on the back half of the thigh, look to the lateral side, the side that's away from the midline, right? So here's my midline, this is away from the midline. Biceps femoris is always your lateral hamstring muscle. So biceps femoris, where does it originate? Where is the origin point? Where does the muscle not move? That point of attachment that remains fixed. Ischial tuberosity and femur. Okay, let's take a look. Remember, the ischial tuberosity is the bottommost part of the ischium. So right here, this ridge-like bump on the ischium, we have this right here. So ischial tuberosity. So that's where the biceps femoris starts. It also starts on the femur. So we're starting here, we're also starting somewhere here, probably a proximal component of the femur, meaning closer to the point of attachment. So ischial tuberosity and femur are our origin points of the biceps femoris muscle. We can visualize it here in this model. Let's take off this gluteus maximus so we can see better. So, aha, okay. So, biceps femoris, we said ischial tuberosity, which was right here. We match this up. And we also said the femur. So we see that going on right here. If we look at the other hamstring muscle groups and we think about their origin, it's actually also the ischial tuberosity. Remember, your other hamstring muscles were the semitendinosus muscle and semimembranosus muscle. Remember membranosus as thin like a membrane. So remember, like a cell membrane is super thin in comparison to the rest of the cell. Similarly, you have a thin muscle right here, the semimembranosus. Semitendinosus, think, well, it has T in it, so T means on top. Semitendinosus is on top of the semimembranosus. But let's look at these muscles. The origin point is also ischial tuberosity, right here. So, given that all of the hamstring muscle groups, or all of the hamstring muscles, origin on this ischial tuberosity, with the biceps femoris origin also being the femur. Given that we have that, that's the point that remains fixed. What is the point that moves? What is our insertion points of the various hamstring muscles? Well, Let's look at the biceps femoris. Head of fibula, okay? Semimembranosus, medial condyle of tibia, and semitendinosus being the tibia. So let's take a closer look. So essentially all these muscles, these hamstring muscles are starting ischial tuberosity, biceps femoris also at the femur. We're going to the head of the fibula as our insertion point, which is in the back side of the knee joint. So we're crossing over the knee joint, and we're in the back side now. We also said medial condyle of tibia, and we also said tibia. And specifically, although you don't need to know it, the back side of the tibia is the semitendinosus insertion. Okay, so we start up here, we end down here. This point remains fixed, this point moves, the muscle shortens in length. When it contracts, bringing this point closer to this point, resulting in flexion of leg at knee. And so we can't forget where we originated from. Yes, we crossed over the knee joint, we crossed over in the back side, resulting in that knee flexion that we just mentioned. But we started at the ischial tuberosity, which in order to get from ischial tuberosity all the way down there, you got to cross over the hip joint. So remember your hip joint, your acetabulo-femoral joint right here? We're crossing over that joint, and we're crossing over it on the back side. So remember what happened when we crossed over the hip joints in the front side. We had flexion of thigh at hip. Well, the exact opposite is true now. We're crossing over the hip joint, but in the back side, causing us to have extension of thigh at hip, like this, or hip extension. And why is that? Well, because these muscles are capable of not only bringing the leg up, because they originate here, they insert here, pulling this up, they pull this closer to this, but as a result, because they start here, and they cross over this joint, and then in the back half, when they contract or shorten in length, they're going to bring this up as well. So multiple functions going on at the hamstring muscle group. We have flexion of leg at knee, shown like this. We also have extension of thigh at hip, shown like that. Okay, so let's move on to the gracilis muscle. So gracilis muscle is your medial thigh component. So remember that so we've removed the decent bit here. We'll put some back on so that this doesn't look a little confusing. And I'll put the sartorius muscle back on as well. Okay, so all right. So it's important to put the sartorius back on, in my opinion, here, because the gracilis is very similar looking. So not to be confused with sartorius. Remember, sartorius is the longest muscle in the body that crosses over the front of the thigh. The gracilis, we got to turn medial. We got to turn the thigh a little bit closer to our midline to visualize the gracilis muscle. So this muscle right here is the gracilis. Where does it originate? Where's the origin? And where's the insertion? Well, let's take a look. So the origin is the pubis, the insertion is the tibia. This makes sense, right? If we look at this right here, we know that this was our pubis bone. And so the origin of this gracilis muscle is the pubis. So this makes sense. We can see it right away on the model. So that point remains fixed. Where are we inserting? This is where things get a little bit technical. So you only need to know that it inserts on the tibia, but in order to understand the muscle's action, it's helpful to understand where exactly on the tibia this inserts. So let's follow this muscle along. Okay, yeah, it looks like it's going to end up at the tibia, but is it going to end up in front of the knee joint or in back? Well, it's actually going to end up in back, and we can visualize that here, this skeletal muscle model. So, we said that we were starting in the pubis, okay, and ending up right around here in the back of the tibia. So as a result of this, we're crossing over which joints? Well, we're crossing over the hip joint and the knee joint. Let's focus on the knee joint for now. Are we crossing over the back of the knee joint or the front of the knee joint? In this example, the back. Because we're starting from the pubis, we're ending up the back of the tibia. So as a result, the muscle shortens in length. This was the origin, this was the insertion. I'm bringing the insertion closer to the origin as a result of the muscle shortening. Like this. So the gracilis also takes part in flexion of leg at knee. We also have adduction of thigh at hip. So this is what's going on at the hip joint. So remember we said this muscle also crosses over the hip joint as shown. Understanding how adduction works here is challenging, but let's give it a try. So remember adduction is bringing the thigh closer to the midline. So abduction was bringing the thigh segment away from the midline. Adduction is bringing it back towards the midline. If we're all the way out here, just like this, move this back, we're all the way out here, we have a muscle that starts from the pubis and it ends up right back here. If it's starting here and it's going to pull this closer to this, right? Because the origin was the pubis, the insertion was the tibia, specifically the back of the tibia. Muscle shortens, it contracts, it brings this closer to this, resulting in adduction, bringing the thigh closer to the midline. So adduction of thigh at hip is that secondary action of the gracilis. Okay, last ones. So tibialis anterior, gastrocnemius, and soleus muscles. So for these muscles, we'll take a look at this leg muscle model shown here. So remember tibialis anterior muscle. Tibialis anterior tells you, well, tibialis tells you I'm near the tibia. Anterior tells me specifically I'm in front of it. Remember, anterior means in the front half of the body. So the muscle that's in front of the tibia is the tibialis anterior, this muscle right here. So where does this muscle originate? Where does it insert? What is its action? So origin point here being the tibia. You don't need to know the exact origin point, which is nice, but essentially it's going to be a more proximal component of the tibia. Proximal meaning closer to the trunk region, so up here. So origin point up here, just tibia is fine for the practical. Insertion point, metatarsal 1, medial cuneiform. So metatarsal 1 is going to be right here. Remember your medial cuneiform is going to be right around here. So metatarsal 1 and medial cuneiform are our insertion points. Those are the points that are actually going to move as a result of the tibialis anterior contracting or shortening in length. So we're going to bring metatarsal 1 and medial cuneiform closer to this part of the tibia. So what happens? You have this, where the toes point up. And remember, when the toes point up, they're looking like this. They're looking like a dorsal fin of a dolphin. So you have dorsiflexion. So dorsiflexion, dorsal fin of a dolphin points up. Dorsiflexion is when your toes point up. The tibialis anterior is bringing metatarsal 1 and medial cuneiform closer to the tibia. Gastrocnemius and soleus muscles are on the back, and these are going to get termed your plantar flexors. So the tibialis anterior is one of your dorsiflexors. You only need to know that one for the practical. I should mention an additional action. Here is inversion. Again, this being a secondary action, a bit less intuitive to visualize, but we can give it a try. So essentially inversion is going to look like this. So it's a very slight action. You might not notice it, me doing it, but ready? Inversion is sort of like this, where the sole of your foot points medial or towards the midline of the body. And so let's think about this. So we're starting here, if this is our origin point, we're on the lateral side. of the leg. We're starting on the lateral side. Where are we pulling on? We're pulling on the medial side. So we're pulling medial, this part towards this part. We're going to have this sort of like inward pointing of our sole, otherwise known as inversion. It's a bit more difficult to understand there, but just in case that explanation might help. Okay, gastrocnemius and soleus muscles, last muscles to go over, and then we'll go over two more things, very brief, but hopefully are helpful. Gastrocnemius. So remember, gastrocnemius muscle is the one with the two bellies. So the way I like to think of this one is gastrocnemius muscle, think of gastrointestinal system. The gastrointestinal system has your stomach in it, otherwise known as your belly. The gastrocnemius muscle is the one with the two bellies, the medial belly and the lateral belly. So maybe that helps, remember it. But here's our gastrocnemius muscle. Where does it originate? Well, origin point being the medial and lateral condyles of the femur. So in case you forget, let's check those out. So remember, condyle is a rounded end of a bone that meets another bone. Medial and lateral just tell us close to the midline, far from the midline. So let's look at the femur. Rounded ends of bone that meet another bone. They're meeting the tibia here. This is the medial component because it's closer to the midline. This is the lateral component because it's further from the midline. So the gastrocnemius muscle is going to originate, maybe we should show it this way, is going to originate on the medial and lateral condyles of the femur. We're just on the back side. So that is the origin point here, the point that remains fixed. But where is the insertion point? Well, the insertion point is the calcaneus. So remember, the calcaneus is your heel bone. Calcaneus right here, gastrocnemius is going to insert on the calcaneus via or through this tendon right here called the calcaneal or Achilles tendon. So essentially, we originated up here, which was on the other side of our knee joint. So you look at our knee joint right here, we're in the back side of it now. We're starting above it. We're actually crossing over the knee joint and crossing over the ankle joint to get to the calcaneus. We're crossing over two joints, which means the gastrocnemius muscle is going to have two actions. Let's check out the action that happens at the knee. So we start here, we end here, we're crossing over the back half of the knee joint. This is going to remain fixed. The medial and lateral condyles of the femur are your origin of the gastrocnemius. This is going to move. This is your insertion of the gastrocnemius, being the calcaneus bone. This moves closer to this as a result of the shortening, resulting in this action, which we have as flexion of leg at knee or knee flexion. So we have that shown here. Our second action here, let's look at what's going on at the ankle joint. So we're crossing over the ankle joint, we're crossing over the back of it. We said we started here, we ended here. If we pull this closer to this, what's going to happen is this. Our toes are going to point down. So if we visualize this from the front, we might have our foot resting here. Let's go ahead and pull the insertion point, the calcaneus, closer to the origin point, being the medial and lateral condyles of the femur. So let's go ahead and pull this closer to this. We're going to have something that looks like this. Toes are pointing down into the ground. When you plant your toes down to the ground, you have plantar flexion. The gastrocnemius, second action is plantar flexion. Last muscle, soleus muscle. So remember the soleus as the soles of your shoes. So the soles of your shoes, if you were to take off your shoes, you pull out the soles, you see these flat soles, flat shaped. Soleus muscle, flat shaped muscle. So this one right here. Where is the soleus originating? Well, it's originating on the tibia. So we're not above the knee joint, right? We're still below it. So we're not going to have an action that occurs at the knee joint because we're not crossing it. So we originate at the tibia, most likely a proximal portion of it, one that's closer to the torso. or the trunk. So right up here at the tibia, and the fibula as well. So remember, the fibula is your more lateral leg bone, and the insertion of the soleus is the same as the gastrocnemius. So essentially, we're starting right around up here on the tibia, fibula, and so we're starting up here, we're ending in the calcaneus. So what are we going to do? We're going to have the same exact action as the gastrocnemius at the ankle. So we start up here at the tibia and fibula on the back side. We end up at the calcaneus. This is our insertion point, the point that moves. We bring this closer to this as a result of the muscle contraction or shortening the length, resulting in the toes pointing downward as we had before, plantar flexion. So hopefully that helps. Think about the different muscles of the lower extremity, their origins, insertions, and actions. And I just want to leave us off with this simple trick right here, followed by just a muscle model that we didn't get to observe in lab. So just a trick to remind you, how do you know if you're looking at internal or external obliques? How do you know if you're looking at internal or external intercostal muscles? Well, remember, this is your serratus anterior muscle. So serratus, think serrated edges, like sharp teeth, sharp. You see these sharp edges. Anterior tells you these sharp edges, they're coming into the front. They're coming into the front half of the body. So serratus anterior muscle. Remember, rectus abdominis are these muscles right here. Rectus means straight up and down. You see the fiber alignment, straight up and down. Draw your line from serratus anterior to rectus abdominis. Draw that line. If the oblique muscles, so remember, oblique means any diagonal cut. Oblique muscles are diagonal muscle alignment. So draw your line from serratus anterior to rectus abdominis. I'm drawing my line. If the oblique muscle fibers are in line with the line that you drew, as it is in this example here, external always. So this is your external oblique. If it's not in line with the line you drew, it's internal. So let's go to the other side. Serratus anterior, rectus abdominis. I'm going to draw my line. Notice that the obliques are going in the exact opposite direction. So those are not my external obliques, rather they're going to be my internal obliques. Let's do the same for the intercostal muscles. So remember that the costal cartilages connect the ribs to the sternum. So these are your costal cartilages. Inter just means between. So intercostal muscles are the muscles in between costal cartilages. If you draw the line from your serratus anterior to the rectus abdominis with these intercostal muscles, you can see that these ones here, they fit my line perfectly. So this fits my line.